In this next lecture, we'll be covering both respiratory and cardiovascular disorders. These two systems are dynamically linked. Heart rate variability biofeedback shows us that the rhythm of the heart is influenced by our inhalations and exhalations. The primary function of the respiratory system is to supply the blood with oxygen in order for the blood to deliver oxygen to all parts of the body. The respiratory system does this through breathing. When we breathe, we inhale oxygen and exhale carbon dioxide. A secondary function, which is no less important, is to maintain the body's acid-base balance. Breathing can be thought of as two simple processes. The chest expands and air is drawn in. The chest compresses, air gets pushed out. Inhalation and exhalation. The diaphragm is a sheet of muscle and tendon that divides the torso into two compartments. Above is the thorax with the lungs and heart. Below is the abdomen. The intercostal muscles pull the ribs up, creating a higher lung volume, which draws air into the lungs. If the throat is open, air will rush in. Rectus abdominis, the muscles that create the bodybuilder's so-called six-pack, are also involved in breathing. During active expiration, the most important muscles are these abdominal wall muscles, which drive intra-abdominal pressure up when they contract, and thus push up the diaphragm, which drives air out. Carbon dioxide is the prime regulator of the respiratory system, not oxygen. The chemoreceptors, located in the aorta, arteries, and in the medulla, are stimulated more by increases in carbon dioxide levels than by decreases in oxygen levels. It's this increase in CO2 that increases the rate of respiration. The byproduct of cellular respiration, carbon dioxide, must be exhaled in order to maintain respiratory balance. This involves three important processes. Ventilation is respiratory flow of the air into and out of the lungs. Diffusion is respiratory exchange of gases between the air spaces of the lungs and the blood in the pulmonary capillaries. And finally, perfusion, the delivery of the pulmonary blood supply to the lungs. Although it seems counterintuitive, hyperventilation, which leads to the blood becoming too basic or alkaline, is due to low CO2 levels. This is called hypocapnia. Other disorders like chronic obstructive pulmonary disease and asthma cause excesses in CO2 and lead to the blood becoming too acidic. Both acid and bases are related to the concentration of hydrogen ions. Higher levels of hydrogen ions in the blood lower the pH levels and raise the acidic level of the blood. Here's a list of concepts and phrases you should learn regarding respiration. A capnometer is one of the devices used to measure CO2 exhalation. The units of measure are torr. A torr is the atmospheric pressure that supports a column of mercury 1 millimeter high. The unit is named after Torricelli, an Italian physicist and mathematician, for his discovery of the principles involved in barometric pressure. A capnometer is a device for measuring the end-tidal partial pressure of carbon dioxide. End-tidal CO2 is the partial pressure or maximal concentration of CO2 at the end of an exhaled breath. Hypocapnia is too little CO2. The word hypo means under, and the word hyper means over. As mentioned, it is caused by hyperventilation, and it causes hypoxia, too little oxygen. The fact that hyperventilation causes cold hands must be remembered when you're doing thermal biofeedback. Often you'll see a restoration of blood flow by incorporating breath training into your work with your client. In addition to hyperventilation, there are other problematic breath habits, which include short, shallow breathing and breath holding. These conditions are often related to stress, that is, hyperactivation of the sympathetic nervous system. However, not all short, shallow breathing is stress-induced. Dyspnea can be a sign of serious disease of the airway, lungs, or heart, and is reason to seek medical attention. There are a number of ways you can use your biofeedback equipment to assess breath patterns. You can use a strain gauge to help you look at thoracic and abdominal expansion. Placing surface EMG sensors on the top of the shoulders can help you spot shoulder breathing or upper thoracic breathing. You'll see a rhythmic up and down pattern on the surface EMG display. Some people even use a thermistor taped under the nostril. An inhalation will cause a cooling, while an exhalation will cause a warming of the thermistor. Almost every patient can benefit from a breath training program, and you might want to devote a few sessions to this important work with many of your clients. Here are some common treatments often used. Training in deep abdominal breathing, in which you're trying to train a person to use less of the thoracic area for breathing and more of the lower abdominal breath. This also involves training someone to use the diaphragm muscle in breathing. The diaphragm is the primary muscle and the largest muscle, the thickest muscle, used in breathing. When this muscle is not used, people tend to rely on those intercostal muscles to do the work of breathing. In time, these upper thoracic cavity muscles become stronger than the diaphragm muscle. They often become the default muscles of use in breathing. Pursed lip breathing is a way of extending the exhalation, holding the CO2 in for a little while longer by exhaling through pursed lips. Training in paced breathing is used to alter the breaths per minute. There are a number of good pacer programs. Please read the cautionary remark in your Schwartz textbook on page 231. Breaths per minute are typically measured by strain gauges worn around the chest and abdomen. This dual method is particularly useful in learning how to breathe abdominally or diaphragmatically.